Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight we're going to rethink crime in a few different ways, including a retrospective look at the infamous 2011 Stanley Cup riots in Vancouver that led to the public shaming of many folks whose lives are still being negatively affected a dozen years after the fact. But first, is Canada's justice system broken? In his much-anticipated book, Indictment, The Criminal Justice System on Trial, our featured guest tonight draws on the lived experience of people who navigated the criminal justice system to wonder if the reactive and punitive tough-on-crime approach actually produces good outcomes. Prime Minister Stephen Harper's criminal justice advisor and UBC law professor, he is Benjamin Perrin. Ben, so nice to meet you. Thanks for being here tonight.
Thanks for having me. Yeah.
So in your book, you basically make this very persuasive case that Canada's justice system is basically rigged against vulnerable folks. Our justice system is not trauma informed. It has elements of systemic racism. And if you're rich, it's way easier to navigate than if you don't have money. Looking at all of this, for the viewer that may not be familiar with you or your work, can you explain how Canada's justice system is failing Canadians?
Well, let's start with people who are victims of crime. So the average person who is robbed or assaulted or something more extreme, like had their family member murdered, if you look at all of those numbers, only a third of crime gets reported to police. And it's even worse when you look at sexual offenses. Only 1 in 20 people who experiences sexual victimization says, I'm going to go to this justice system for help. So on a wholesale basis, people have completely given up on the criminal justice system. At the same time, we see rising crime rates, right? We see people who are coming in and out of our jails and committing these offenses and just cycling through the system. And really right now, there's sort of two things on offer. One is sort of tinker with the status quo, like, yeah, we have a massive disproportionate number of Indigenous and Black people in jail. Let's have some more Indigenous judges maybe. That's not shifting the needle, right? Let's have a drug treatment court. That's not shifting the needle either. Dabble a little bit in partial decriminalization of drugs in BC. That's not shifting the needle. The other option that we're seeing now, it's increasingly popular, not just among politically conservative parties, but we're seeing it as well with even the provincial level with the NDP here in BC, and even with our local politicians, is going back to our tough on crime approach. So it's basically that more police, tougher conditions of incarceration, longer prison terms, denying bail. These are the ways that will make us safer, we're being told.
And so what's wrong with that? Because I feel like that is the public reaction when they see, really awful crimes on television, or they hear about crime rates going up. They go, yeah, let's be tough on crime. Yeah. Well, what's wrong with that approach?
It makes superficial sense, which is why it's so appealing. Right? Some crimes happen. Let's get some people with some guns on the streets. That'll stop it, right? And the evidence is that's not
the
true.
Logic they're selling us.
I know, and it doesn't. It's not true. So when you look at a whole bunch of different examples from the United States, United Kingdom, first of all, if more police and harsher penalties would make us safer, the United States would be the safest country in the world. It would. It's not. Yeah. There are Republicans who've gone full down the tough on crime program, and they have flipped right over.
Right.
The truth is that more police are reactive, right? They respond to criminal incidents. They don't actually prevent them by and large. And the research shows that more police doesn't show you have lower crime rates. And so when it comes to prison, we looked at studies going back to as far as 1958. These are Canadian studies. Okay, dozens and dozens of them, over 300,000 offenders they've looked at.
Yeah.
And what they found was a damning conclusion: incarceration increases reoffending. People are more likely to reoffend when they go through these very traumatic, punitive criminal justice systems. They come out worse off, and then they're released in the community. People who we interviewed for this study, this isn't all just book research. We talked to people who've spent much of their lives, almost all their lives, I'd say their adult lives, but many of them were incarcerated since they were 12.
Wow.
Okay. And so
you are almost set up to fail if you're in that system at such a young age, then, right?
And I mean, like, let's talk about some of the people in a second, but some of the stats even. So the average literacy level of a federally incarcerated person is grade 7. Okay. That's not coincidentally the age we start locking people up. I have a child in grade 7. That's age 12.
Yeah.
And I spoke to people who were locked up when they were 12 years old. Some of them, one in particular, the first person who responded to our research poster, which we sent out throughout the whole country, she's 39 years old now. She was 12 at the time she started getting incarcerated in a co-ed institution, places that still exist today.
Wow.
When she swore at the guards, they would lock her up in the rubber room. Later on, when she was in an adult facility, in a federal penitentiary, she tried to commit suicide. She's bleeding out. They literally stitch her up and put her back in solitary confinement.
Wow.
That is the kind of treatment. It's inhumane. It's cruel. It costs a lot of money. It costs a lot of money to lock people up. And then when they come out, they're much more likely to reoffend than if we had been more humane and dealt with some of the underlying causes and issues. So, when I see these news stories of someone who has had 30 prior offenses and then they're attacking a random person for no reason, let's ask some questions.
Sure. Yeah.
Right? Well, why is that continue to happen? And so what we see in other countries like Norway, where they have more humane prisons, where they had a system like ours, but they've decided when people are inside, we're going to ask one question. What kind of a neighbor do you want to have when this person gets out? Because basically everyone in our jails is getting out, almost every single person. And I don't know about you, but I am sick of seeing the higher risk offender posters go around on social media. Someone has served their full sentence and they're still high risk. What have we been doing for the last years this person was inside?
So Ben, there might be some people who are listening to this and going, okay, sure, they're on board for reducing poverty. They're on board for tackling systemic racism. They're on board for creating better equity for lower income folks to navigate the criminal justice system. But they might say you're being an apologist for criminals. And if you commit a crime, and especially something that's violent or that harms someone, you deserve punitive outcomes.
Yeah.
So what do you say to that person who goes, no, I don't care about rehabilitating these people. They did awful things. They get what they deserve.
Yeah, sure. Get out to stockades. We used to lash people in Canada and had capital punishment. Like, how far do you want to go? So we have a choice as a society. So the choice is we can continue down this road of a punitive justice system to punish people, to hurt them more, and they will hurt us more. Or we can follow what I describe in this book as a new transformative justice vision. I think the goal of our justice system should be to transform the trauma that people experienced as victims of crime and as people who are offenders. And there are people who need to be separated from society for our safety. Absolutely. So when they're separated, I think they should be getting trauma counseling, have access to substance use support and treatment, have mental health counseling, get vocational training, work in prison, get paid a decent wage so that they can actually get out and they're not on the street homeless in prison shoes, because that's what we hear. And when those are the options that I sort of put forward for people, I say, look, yeah, we can have people who are incarcerated who are doing yoga and pottery classes, or we can have them sharpening their shank at night. They are getting out. Who do you want to be your neighbor? That's the question. And in Norway, where they took this more humane approach, their recidivism went from around where ours is, 60 to 70% reoffending. Right. In and out, down to 20%.
Wow.
Okay. So
which saves everyone money, saves everyone the hurt and harm. I feel like aside from the politicians that announced decriminalization in BC, this pilot project, drug users were not satisfied. They were saying that decriminalization here was quite limited in terms of how it was rolled out. People in the center were a little bit more skeptical. They were saying, okay, decrim is fine, but maybe the supports aren't there in terms of services and maybe the safeguards aren't there for the public. And then you had more conservative voices saying that decriminalization is going to be a failure from the outset. Sure. At this moment in time, 8 months after the fact, everyone seems dissatisfied with decriminalization in BC. So where did the province and I guess the federal government get it wrong?
I think it's very clear where we got it wrong in BC. It's following politics and not policy. I mean, that's what's going on. That's why you end up with these mushy middle outcomes that no one's happy with. The fact is that we are not following the best available evidence on how to save lives. There is no epidemic of people using drugs at playgrounds. There isn't. This is a made up political concern.
Yeah. Much of the decrim conversation has been around public use, right?
Yeah.
People using drugs in public.
Yeah. And there were attempts to find photos of needles in your park. They're not there. Like, they're not there. It's a boogeyman, And the fact is, what is real is that unregulated drug deaths continue to be the leading cause of death from ages 10 to 59 years old in BC. Wow. That's what's real. So quite honestly, it's politics, and it's absolutely a shame. I mean, this has been a public health emergency since 2016. We are still talking about the same policies. They're still being stymied. And, Premier David Eby, quite frankly, is being really hypocritical here. I mean, in announcing this new policy change, he said, well, hey, people can go and use the overdose prevention sites. The fact is that most British Columbians can't access those. There aren't enough of them. And the vast majority don't allow people to ingest drugs by inhalation, which is the leading way that people are dying right now. Right.
So then really quickly, what should have the province done in its decrim rollout? What would you have liked to see in an ideal world?
I think that there needed to be a concerted policy, that there needed to be a whole series of things that were done. One would have been much better public communication about this, addressing concerns as they came up. I think there is absolutely legitimate ways to talk about public use for sure. But the way that this is rolled out is, I think you'd be hard pressed to find really any public area that you could legally use drugs at this point. I mean, it really, if you map a city or a region, it really is continue to push people into the back alleys, which is not where we want them to be.
Right.
And so the other side that I have to bring up is that, it is toxic, unregulated drugs killing people. Those have to be substituted with a regulated, safer supply. And the problem that we have right now is people are not being provided with a substitute that's reasonable. It would be like if there was poisoned whiskey and I was like addicted to whiskey, and you're like, here's some Bud Light.
Right.
Okay. It's not, hydromorphone is not a substitute for someone who has a substantial fentanyl addiction. Right?
But is that politically palatable to give people safe supply of fentanyl?
Sure. I mean, I would go in and say, look, if someone is dying of toxic meat or eggs or milk, we are going to take that off the shelf and we're going to substitute it for them. We're not going to open up like a BC Cannabis or BC Liquor Store. I'm not proposing that.
Okay.
But it's that someone is going to use it anyway. We're going to provide them with a substitute. That actually polls really well if you want to talk polling, and it also addresses this issue that people have concerns about diversion, that that people are just sort of not using their safer supply. Many people are using safer supply and it's saving their lives. So we need to really take a step back and begin to try to depoliticize this issue. And, I think all the parties before actually did get behind safer supply, including BC United.
Right.
I was a witness before that committee. They got behind it and they supported it. And now they're trying to play politics, right, with it. There are two parties on the right now in BC provincially. They are vote splitting. And the NDP, they have got
Does it worry you that we're going to, really quickly, does it worry you that we're going to get to a point where we actually recriminalize drug use? I mean, a lot of people said we had de facto decrim where police weren't going after it, although they were seizing, people's individual drugs. Does it worry you that we'll actually start putting people behind bars for drug use based on what we're hearing from our politicians?
So I would say we were already putting people behind bars with substance use disorders. It's not for the possession of the drug. It's for all of the ancillary things that go with the criminalization of it, right? And so one of the things that's pretty shocking is that the proportion of people in our correctional facilities in Canada that has a substance use disorder is between 70 and 93%.
Wow.
So we are caging people with substance use disorders. You are 50 times more likely to die of a drug overdose if you're incarcerated. That's because your tolerance goes down rapidly. You're still getting drugs in jail, but not the same as in the community. And when we interview folks who use substances who are in prison, they'll tell us, I used what I thought was a crumb and I was on the floor and I'm lucky to be alive because someone was there to revive me. So incarcerating people with substance use disorders is happening routinely and it is killing people.
Ben, this was illuminating. Thank you so much for your time tonight.
Thanks.
Absolutely. Folks, that was Professor Ben Perrin. His book, Indictment, The Criminal Justice System on Trial, is one of Canada's most anticipated books of the year, and it does not disappoint. Be sure to pick it up at your local bookstore. Now, after some business, it was one of the largest investigations in Canadian history, with 887 criminal charges laid against over 300 people, many of whom are still publicly shamed for their participation in the 2011 Stanley Cup riots in Vancouver. But did all those people deserve to have their entire lives ruined for vandalism or petty theft just because of the high nature profile of their actions? We'll talk about it up next.